You think one day AI is going to replace doctors?
AI is going to replace the doctors of today and the way that medicine is practiced, but it's not going to replace the profession of healing and caring for other people. AI, it's the most powerful tool that we have sitting here in 2026, but I think we always have to be thoughtful about when we're sharing our health data, can it be mined and used for other purposes?
All behaviors are goal-oriented. It's like you don't get off the couch unless you have a goal.
Different people are motivated by different things, and it's part of the strength of leveraging AI today is we can understand what are the things that drive individuals, and so then how can we actually motivate that person?
Is healthcare cooked, or can we find a way of righting the ship?
And I am absolutely convinced that we can right this ship, but it's going to take a couple of things from us, and it starts off with
Dr. Nasim Afsar, welcome to the show. How you doing?
I'm doing great, Max. So
Great to have
excited
you
to be
in.
here. I
Of
know.
course. I'm pumped for the conversation that we're about to have. Hopefully we're going to keep it fun because, these are topics that are, I think, really important and can, make their way into the weeds if not handled with levity. Because healthcare is a serious topic. We spend more in this country on healthcare than almost any other nation, maybe more than any other nation by a wide margin, and yet our outcomes are among the worst.
It's really shocking. And I do think that we're going to have a lot of fun because I have to tell you, Max, I can't think of a more fun topic than AI and healthcare, right?
I love it. Yeah, no, I think it's great. So is healthcare cooked, or can we find a way of righting the ship, so to speak?
Yeah, that's the critical question, right? The $5 trillion question. I am an optimist, but I've also been in healthcare for the last 2 decades on the delivery side, working with payers, pharma, med tech, retail pharmacies, food and beverage, basically all the key stakeholders in healthcare. And I am absolutely convinced that we can right this ship. But it's going to take a couple of things from us, and it starts off with a shift in mindset, and that's what I hope we get a chance to talk about.
Mindset and also and AI. Like, is this ever something that you saw coming? Like when you were going through medical school, like the way that AI is now empowering healthcare providers and patients?
Yeah, so I come from a day and age where we practiced on paper, where the extent of kind of what you knew existed on the number of pages that you had in front of you, or if you dared, you went to the basement to medical records and you actually brought up charts. And at times, Max, like you needed to bring a medical student with you because there were so many charts to carry. Like one person couldn't carry this stuff, and so thankfully our medical students would volunteer to do this. Fast forward, we digitized healthcare through the electronic health records, and that was really exciting. I really thought that was going to be the shift for us in healthcare. The challenge with that was we took workflows that were outdated and did not work, and we just kind of shoved technology on top of it. With AI, there's tremendous potential, but what I'm concerned about is that we would do the same, that we kind of take these systems that are incredibly complex with very dysfunctional elements, and we just shove AI on top of that. And why I focused on the shift in mindset is that I strongly believe AI is not going to be the panacea. AI is a tool. It's the most powerful tool that we have sitting here in 2026, but it's that different way of thinking that's going to enable us to leverage the right tools to get to the goals that we want.
Damn. So what do we need to do then? Like, is it when you say mindset shift, are you talking about the mindsets of physicians, of like the insurance companies, or of patients, of consumers?
Everyone, Max, everyone. So to me, the key piece that has to happen is that we have to change the focus from all the different silos of stakeholders that we have, all of those people that I mentioned, so providers, payers, pharma, all of those groups. We have to shift it from their silos and their focus on illness to realigning around the consumer of health and care, that's you and me, and the focus on health for that consumer. That's the change in mind shift. Because when we do that shift in mindset, the quality of care, the safety of care, the prevention, all of that stuff fundamentally changes, And that changes the economics of healthcare. So back to your point at the beginning around the cost and the quality, which is, I mean, I can't believe that this is where we're sitting and it continues to get worse. To fix that, we got to shift how we're thinking about health and care today.
Do we have a sick care system, or is it a healthcare? Like, is it appropriate to call the current state of the healthcare system a sick care system?
I would, absolutely. When I was a practicing hospitalist, I saw people come into the hospital with metastatic cancer. And now I'm talking about rather preventable cancer like colorectal cancer. And when I would see a patient with metastatic colorectal cancer, I thought, it must be that they don't have good access to care. It must be that they don't have a primary care doctor. Same with, I would see a diabetic patient, a patient who has high blood sugars, and they would come into the hospital and they would have a horrible toe infection. We'd have to remove a toe, or they had kidney damage and we had to put them in dialysis. I thought, oh, this must be because they didn't have access to care. I was shocked, Max, at the number of times that people actually had insurance, they had physicians that they were seeing, but these chronic conditions did not get addressed. And it wasn't because the physicians or nurses or the system were bad or didn't care or didn't know what to do. I went back and I looked at the notes, and it's because when the person went to see their doctor, they had 5 other acute things that needed to be taken care of, and they never got to, hey, you're at that point, it was 50, the age for colorectal cancer screening. Hey, you haven't done your colorectal cancer screening and you're 55. It just didn't make it onto the list, which is why I think it's so critical, and I'm excited to talk about intelligent health, but it's so critical for us to leverage the most powerful tool that we have, which is AI, to help augment and support everybody, starting off with the consumer of health and care, but then providers, pharma, payers, and everyone else in that ecosystem.
It makes total sense. I had this revelatory moment. It was a couple years ago now, back when the GLP-1 drugs were starting to gain widespread ubiquity. I was at a restaurant, and I understand that obesity is can be a really difficult condition. But we're now in an era where, for the first time, I feel like it's more treatable than ever before. And these drugs should not be like a first line of defense. But I'm, imagining, I've never, I don't have the lived experience of somebody with obesity. But it's like, if you spend a lifetime trying to, use diet and lifestyle to achieve a healthier weight, and it just isn't working for you, well then, as a fail-safe, I'm so grateful that we have these drugs at our disposal, making obesity in a way kind of optional these days, because we now have these drugs, right? They're now ubiquitous and everybody knows about them. Similarly, with AI, it's so incredible. You just need to know that it exists, that it's available for you. What an incredible tool. I mean, I was, we just a couple weeks ago, the new dietary guidelines were released, and there was this big uproar online. People were like, well, the dietary guidelines are contradictory. They contradict themselves because you've got red meat at the base of it, and yet it still, promotes this 10% saturated fat target. And I went directly to AI, and I was like, hey, AI, architect me a 6-day meal plan, maximally including red meat, that comfortably lands below the 10% saturated fat target. And it did that in seconds. I had a 6-day meal plan presented to me. So it's amazing, that now we live in this time where I just feel like the excuses it's like in the bucket of possible excuses, it's getting less full by the day.
So you're talking about a really critical issue, which is we have this very powerful tool, but you have to know and use it the right way, and it has to be created to serve the consumer versus the system. And I think that's a big shift, is how do we actually leverage this tool, not just to help process claims faster, but to answer exactly the questions that you're talking about, which are the day-to-day experiences that ultimately add up to create what it means for you to be healthy. I had a similar insight about 2 years ago. I had a corporate job and I worked across time zones across the globe. And I realized that on days where my meetings started at 5 a.m., which from time to time they did because I was catching different time zones, and I had about 17 to 22 back-to-back Zoom meetings, that invariably between and I'm a very quantitative person, so I actually went and got the data. Between 10:30 and 11 a.m., I'd be on Zoom. I would take my phone under the table and I would go to my favorite food delivery app and I would say, okay, do I feel like that artisanal donuts that opened up around the corner? Do I want this piece of chocolate cake? Max, I was going for the worst foods at the time that I actually needed the most amount of nutrition to be able to cognitively be present and function. But that's what at that low point I was craving, right? I'm craving the fats, I'm craving the sugars. At the same time, that same food delivery app statistically could tell you that actually 95% of the time when I go and order stuff, I'm ordering something really healthy. It's the salmon bowl, it's the lentil soup, again, we are very fortunate to live in a city where we've got lots of really great options. So I was having this behavior, and then at one point I realized, I was like, wait, all of my data is digitized. My calendar is digitized. My food ordering practices, both during times of stress and not, are digitized. If only all of these were connected with my health goal of, I want to move through the day with energy, I want to have cognitive clarity, I want to be healthy. If it had that overlay, then instead of waiting for me on those days to sneak my phone under the table and order something, half an hour before that, it could send me a message, right?
Yeah.
It could say something like, hey, Nasim, looks like you're having a really hard day. Can I order a lentil bowl for you? And, it's ready, teed up. I just swipe and it would be delivered. Now, as the consumer, I can still say, I really want that chocolate cake and make the decision that I want. But if you decide differently, even half the time, that over days, weeks, months, years adds up to a fundamentally different physiology, right? And so I think this is where it's really important to realize this is an incredibly powerful tool, but for it to work effectively, it actually has to bring all of those different components of our data together, because you're not just the silo of your sleep data, and you're not just the silo of your activity data or the silo of your nutrition data. You're all of those things along with what your chronic medical conditions are. And now we can bring them together.
Yeah, maybe you could talk about how agentic AI is going to help kind of square that circle. Maybe now because the digital landscape, the way that we interact with these various tools is so fragmented, maybe now there's friction when it comes to bringing all of that data under one roof, so to speak. But eventually, when we have agentic AI running everything, running our lives for us, that kind of also sounds like a double-edged sword.
Yeah. Too. For sure. And I think that this is where, while I am a tech enthusiast, I strongly believe that it has to be human-centered. And by that I mean, and it means that we have to have clarity around what it means for something to be centered around us. And what it means for you is going to be different than for me. Thankfully, with AI, we can have personalization for you and for me. It doesn't have to be different. I do think agents bring in this whole nother layer, and I was just reading about this morning, this whole other layer of capability in terms of how do you then take these different competing interests, right? Because I have to get to bed early to get the number of hours of sleep that I want, but I also want to work out. But with my busy lifestyle, that also has to happen in the morning. And then what am I eating, drinking to make sure that I'm fueled properly? All of those different pieces, there has to be a reconciliation of what happens. And agents can do that. Agents can pull all of that together. And again, based on your preferences, it has to be driven from you. That's why it has to be human aligned. Can help reconcile that. Now, right now we haven't done that, and there has to be a lot of testing and further development for that to happen. But the capability is there for that to happen.
I love it. How should everybody listening to this begin if they're not already using AI tools to improve their health?
Yeah, that's a really great question, Max. I have to say, I think about that a lot because I do think there's tremendous potential in leveraging AI, but you do also have to know the downside. So, for example, when you look at the large language models, they are taking all the information that's out there. There is good evidence-based information out there, and then there's a lot that has no basis to it. One of the things that I really appreciate about what you do on this show over and over again is you go back to what is the evidence, and when there's not evidence, you talk about that. And there are things that we may do that don't have evidence, not because they're wrong, but because no one has studied it to have evidence. But we know that it positively impacts us, and we do that. But we have to be able to distinguish between that, because some of this stuff has evidence that says it's not good for us. So it's, where there is evidence of harm, we have to be aware of that. Where kind of your consumer of health and care needs to be aware is that when you go, how you ask a question can really make a difference. And so making sure that you're framing health questions, because it does ultimately impact your health. It's different than when I go to my generative AI and ask for a recipe with mushrooms and tofu. I'm going to put good ingredients together. I'm going to get something out that will be good. When you're asking about your health, you want to make sure that you are qualifying based on the available evidence. Show me the evidence, reference the evidence, because you want to look at that. And if it's coming from a reputable academic medical center or a reputable study, then you can feel much better about that. You can also ask it to give you broader opinion that's not evidence-based, and you can look at that and you can use judgment. But I think it's important. It's important when you're asking health questions to make sure that what you're getting is evidence-based. I will give you one caveat, Max, and this was a story I heard recently that kind of broke my heart. A good friend of mine was sharing how he was helping in the management of a condition for his sister, and he's a physician. She had been having some abdominal pain and pelvic pain on and off for 5 years, and he had helped, being in healthcare, kind of navigate her healthcare journey. And they'd done a variety of scans, CTs, MRIs. They'd seen a number of specialists. They are now pelvic pain clinics that specifically kind of look at women with pelvic pain. And basically, she was written off. She was told that nothing is wrong. She's perfectly fine. Fast forward 5 years, now on more updated scans, it looks like she has a very advanced case of endometriosis, which is actually a rather common condition that a number of women have that can cause pelvic pain and discomfort. Her case tends to be is unfortunately more severe and is going to require some much more invasive surgery. We were talking about how could this get missed in today's world, considering that this is actually a very common thing. And if you put these constellation of symptoms together on Google, one of the top diagnoses that you would get is endometriosis. And then we had an interesting idea about, hey, what happens if you take the very first scan? Because there was actually, on going back to the very first scan, some evidence that there were some things there.
And it was missed?
And it was missed. Now, it wouldn't be unusual for it to be missed, but it should be picked up. But it was like, hey, would a large language model be able to pick that up? Here's what was really, really disappointing. It could not pick it up. Not because it wasn't there, and not because a trained radiologist going back wasn't like, yep, it's here. But because the data that it trained on didn't have as many examples of endometriosis in this way to then be able to identify that. So that's kind of the piece that you have to be aware of. If you are part of a population that historically hasn't been robustly evaluated, like women, 50% of the population,
Right.
there could be things that are there that could be missed, not because they're not there, but because the large language model doesn't have enough data to be able to identify that. And so that's, again, kind of going back to how things have to be human aligned. We have to do this thoughtfully so we can call out those pieces and then make sure that we are training these models to address those gaps.
Yeah, and it goes back to what you were saying at the beginning that, we have prior to the digital revolution, if you want to call it that, the vast majority of medical records throughout human history, up to the dawn of medicine have been on paper,
Yeah.
which is basically you might as well be on papyrus.
Yeah, and I think, as we move forward, making sure that we are getting that information and data from lots of different sources becomes really important. I love tracking and tracing my biometrics in lots of different ways. And back in the early days, I got a wearable and loved the fact that I could track my activity and my sleep. And I thought it was really interesting. Where the gap was for me, Max, was the tracker would tell me in the morning, it's like, you got a great night of sleep. The day is yours. It just, it had these very empowering language. And I felt like crap. That I didn't feel really good. And then on another day, it was like, wow, it looks like it was a rough night. Take it easy today. And I was like, I'm going to go for a run. I feel really good. And I don't think it's because they weren't effectively tracking what was happening to me in my sleep. I think it's because how you feel in the morning is dependent on multiple different factors. And if you're just looking at sleep, you're missing, what was your hydration the prior day? What did you intake? Did you have stress from work? Did you have a bad interaction with someone that you're mulling over? You could be sleeping well, but it's still with you. You don't feel quite right. There are a lot of different pieces that go into what enables you to feel really good, that sense of well-being. And back to kind of, we were joking about medical records being on papyrus. I think the other piece is we have digital data today, but it is all siloed. And unless we're able to bring it together, it's not going to give you a full picture of what is Max like and what's optimal for Max. I think that this is, to me, kind of the future of precision health. It never made sense to me, Max, when people came out and they're like, you got to drink 8 cups of water a day, take turmeric, do 10,000 steps. I'm like, how is it possible that there is a magic number of steps? Maybe I need, 12 cups of water, or maybe I need 5 cups of water on certain times of the month versus 12 on other times. Maybe turmeric doesn't work for me that well. Maybe it's another supplement, and I feel like right now people do that by trial and error. I think what AI enables us to do is be able to look at the population and say, there is evidence because we studied stuff. Now we can also look at real world evidence. What are people actually doing in day-to-day life, and what's the impact of that in how they feel, their biometrics, their labs, to then be able to give you specific guidance. So maybe you wake up in the morning and, that morning you're instructed to take 2 tabs of turmeric, but it doesn't need to be a regular thing for you. Or maybe one morning you're told to take more water than you usually do, or you need less water. It provides you personalized guidance versus the one size fits all that we see right now.
That makes total sense. Is there an LLM, a large language model, that you think is doing better than others when it comes to being, a resource for people, being evidence-based, bringing all of their data sort of into one, narrative that's maybe more cohesive, more understandable than others?
Yeah, so I'll say I use three at the same time. Trying to be mindful about the environmental footprint that leaves, because there is a lot of resources that get used when you do a query. But I use ChatGPT, Claude, as well as Gemini. And I use them for different things. I think from my perspective, while there are things that each of them is a little bit better than the other, for the most part, they're the same. I was at the JPM Health Conference, and OpenAI talked about how over 200 million people weekly go to ChatGPT to ask for health advice. And we know that people are uploading documents and information. They now have ChatGPT for Health, which is giving you a private, secure space to be able to pull data in and then be able to ask it questions. To me, though, and this goes back to my upcoming book, Intelligent Health, instead of kind of that passive way of you're going to put stuff in, you're going to ask for interpretation of your data, what you need is really intelligent health, which is now with your goals, what are the things that you need to do to actually be able to ensure health? And what I mean by goals is we've kind of trained everyone to think in terms of medical conditions, like I'm going to control my blood pressure, I'm going to control my cholesterol, my diabetes, as opposed to saying, I want to wake up in the morning with energy. I want to move through the day with a clear head, like human goals, right?
Yeah.
Like goals that we can now set those human goals and have the intelligence on the background take our lived context along with our chronic medical conditions and then give us guidance in terms of, and the guidance can be in the language and the tone that we want. It can be as frequently or as least intrusive as we want. But we now have the technology to say, for you, with the goals that you want, with what your lived experience and genetics and chronic conditions are, what do you need to do to kind of optimize health for Max? And that to me is the concept of intelligent health. It's unifying the 20% of what determines your health, which is what happens in healthcare delivery systems, with the 80% of what determines your health, which is your lived experience, the air you breathe, the food you eat, your stress, your genetics. Applying that layer of intelligence and then making it consumer owned and consumer driven. Because at the end of the day, you have to own and you have to be in charge of this data.
So how do we do that? I mean, is it like just signing up for one of these LLMs, creating an account, and then entering in like basic demographic, anthropometric data, and then just stating your goals? Is it that simple?
Yeah, so I mean, the capability to build intelligent health is super simple. And I talk in the book, I'm like, the tech part is actually the easiest part. And again, as we saw this January, we've got two large organizations between both Anthropic and OpenAI who are putting a stake in the ground and saying we are specifically going to be focusing on healthcare with OpenAI on the consumer and with Anthropic focused on clinicians. But the capability is really there in all of these LLMs in terms of taking in your data. But what I'm talking about is taking it a step further. And this is where, again, I think it becomes so important to be to have the consumer in mind is right now you can put your data, you can ask questions. There's not that structure to say, what are the goals that you're looking for? There's not that kind of 24/7 partnership and coaching. There are a number of startups that are working on building this. Again, because the technology piece is so commoditized now, Max, like that's not the difficult part. So I think big tech can do it. Startups can do it. Large delivery systems that are invested in healthcare and the well-being of populations can do it. I haven't seen a model yet that I would say like, yes, they've got it. I worry too, I think we always have to be thoughtful about when we're sharing our health data, can it be mined and used for other purposes? This is the most intimate data that we have, so we want to make sure that we are sharing it in environments that are safe and secure. But again, I think that capability is there. We haven't quite built it, but we're on that path.
So did you write Intelligent Health then as a framework for some engineer to basically create some kind of overlay or app?
Yeah, so it's actually written for the consumer of health and care. So it's written for us in terms of this is the capability that exists. This is how it can change your health, your well-being. And this is how that entire ecosystem can align around you, focused on your health, to then be able to continue to thrive, but ultimately focused on you. It really kind of goes back to that shift in mindset that I was talking about at the beginning around what we need to do as a society, both as consumers and also as industries that are involved in health and care, to realign around the consumer. Again, we know that we failed because there is, as you know, a $200 billion consumer health and care industry. So the consumer is saying, I'm not getting what I need, and I'm having to go and find that. The challenge with that is so much of what's out there and what people are spending money on isn't evidence-based, isn't advancing health and care. And even when it is evidence-based and can advance health and care, it's in a silo as opposed to integrated. I think that the silo piece is a part that I spent a lot of time thinking about, because we make really critical decisions in healthcare around that 20% that happens in a healthcare delivery system without that broader context. And I was thinking about this concept when I was getting on a plane one time. That was kind of the section of the book that I was working on. I had my laptop open, and I was thinking about this. And the pilot comes on really nicely, kind of tells us about it's going to be a great trip. We have some bumps here, but it looks wonderful getting into LA. And I was thinking to myself, like, how would I feel if he came on and said, ladies and gentlemen, thank you for flying with us. I just want you to know we only have 20% of the data to get you home safely. But don't worry, we're all really well trained and well intentioned. Like, that's literally what we're doing in healthcare, Max. And you wouldn't expect, like, you wouldn't stay on that plane, right?
No.
If the pilot said that. We are making critical decisions about prevention around chronic illness, having only 20% of the data that determines someone's health. And so I actually had the idea for Intelligent Health about 20 years ago, back in the day of paper and pen, where, and I talk about this in the book, I had a patient, Elena, who had been hospitalized with uncontrolled diabetes. She was in her 30s, so quite young, and had a series of hospitalizations. She had been discharged from the hospital, and I was now seeing her in the post-discharge clinic. So basically like the one visit that we would have with patients just to make sure that they're tucked in well and have all their visits. And as I was reading her chart, I remember thinking, I'm like, this is, I know this case, like this is, we call this type of patient a non-compliant patient. There's all this great evidence about what to do. Kind of to your point, like the science is there, the resources are available. She's just not doing it. And so I kind of jumped into my script in my head around what I was going to talk to her about: her medications, her healthy, carb-limited diet, what she needed to do in terms of activity. And so I go in the room and I'm telling her all this stuff, and I'm looking at her, and I'm like, her body language is like basically the exact opposite of yours, where you're fully engaged. And she was like, obviously very withdrawn, and this wasn't registering for her. So right before I left to go see the next patient, I was like, hey, does this plan sound okay to you? And I remember it was almost like an afterthought, because I felt like she just wasn't, like, this wasn't resonating with her.
You were like talking over her.
Exactly. And she looks down at her shoes, and she kind of starts mumbling that she lost her job a number of months ago. She lost the lease on her apartment. She was living in her car, and that she couldn't really buy the medication that I was talking about, and she couldn't really you buy the fresh fruits and vegetables and the lean chicken, and it was no good for her to go see the nutrition counseling. Like, she couldn't really afford any of that stuff. And so I just watched that really perfect plan that I had unravel. And I have so many cases like that, Max, where I had this moment where I was like, why are we making decisions and trying to help people when we're not seeing the whole picture? We have to unify this data. We have to bring it together. And back then, we didn't have the technology to do it. That's very different, again, sitting here in 2026, where we are tracking more of that 80% than we ever have.
What do you think, like, now with everything that you've learned over the past 20 years, I mean, if you could go back to that patient, what would you tell her now, today?
I would start off with, what do you want out of your health? Like, what does feeling good and healthy look like for you? I think that's where we lose a lot of people. We assume we know what you want, and we're trying to get you to the numbers that we need for you to have optimal health. But I can tell you, those numbers don't work for everybody. A blood pressure range could be too high for some people and could be too low for others. That's why some people don't take their medications or half their medications, because they don't feel good. I think I would have started off with what feeling good meant for her.
Yeah.
And then understanding not just the 20%, which I had a really great understanding of what her clinical conditions were, but that 80% entailed. And then it requires having a system. And I talk in the book, the majority of the book is, how does this entire $5 trillion system, $5 trillion plus system, realign around the person continuing to make the revenues, the margins, and the missions that they each have. But how do we now realign that system to actually help the individual? So, fast forward to today, and there are insurance companies that are working with grocery stores, leveraging technology to say, for this group of patients with these chronic illnesses, if they get the lean proteins or fresh fruits and vegetables at the time they go to the checkout counter to pay, those items will be taken off of their of their bill. And so you're now aligning the system. Instead of paying for the sick care or waiting for someone to get worse, you're aligning it to what can I do to actually help you be healthy.
Yeah, I love that. People have to want to change. And it's like, all behaviors are goal oriented. It's like, you don't get off the couch unless you have a goal.
Yeah.
That goal could be like getting a soda, could be getting a snack. Like, it's like, and for somebody like that, it sounds like, yeah, I mean, like, she might not have wanted to change when the incentive was just to see numbers improve on a page, right? But
that doesn't mean anything to her.
Right, but to frame it like, what if your joints could feel better? What if, you reduce your risk for losing a limb down the road,
I think that's a really critical point, Max. And different people are motivated by different things, and it's part of the strength of leveraging AI today is we can understand what are the things that drive individuals, and so then how can we actually motivate that person? But this kind of takes me back again, like 15 years ago when I was in the hospital, and one of the things I was working on was fall prevention in the hospital. You have lots of patients, especially as they get older, when they get hospitalized at night, they can get a little confused. They can try and get up to go to the bathroom. They don't realize they're attached to a lot of things, or that they could get lightheaded when they get up and they fall. And these falls can have really significant consequences, right? People can break hips, they can bleed in their head. It's just problems that they don't need when they're already in the hospital with an issue. I was talking to a unit manager around how, despite our best efforts in educating patients, that people were still getting up and falling. And, our education was, hey, you're at risk for a fall. We're going to put this bracelet around your wrist. That means that you're at risk for a fall. Here's the call button. Call your nurse if you want to get up. And these were otherwise independent adults who were like, I get out of bed in my home all the time. Why can't I get up here? And they would get up. So I decided to go in and talk to patients. And I ended up interviewing 10 people just at random who are at high fall risk. And I asked them, do you know what could happen if you fall? And I have to tell you, Max, without fail, every single one was like, oh, like I'd get a bruise on my butt. It's like, I don't know, like if I fall, I get up. Like no one in their thinking about a hospital fall was thinking, I can bleed in my head, I can break my hip. And so making sure that we are translating what's the right thing to do, what's, again, evidence-based health and care in terms that is meaningful to people. Like for someone, it could be that they want to have energy to run after their kids. For someone, it could be that they want to feel good about themselves and have good energy levels. You're still going to manage the same stuff, but you're managing it differently for that goal that the person has.
Yeah. What would you say is the 80%? The big levers that typically will help to keep people out of the hospital setting?
Yeah, I mean, I think that the 80% of what determines your health is a lot of stuff that you talk about on this show. It has to do with the foods that we eat. It has to do with the impact of everything from the air that we breathe to the stress that we carry. It has to do with some of what's in our genetic background and what predisposes us to one thing versus another. It's our sleep. It's all of these different pieces, and I do think that for different individuals, the interaction of those are going to be slightly different, which is why it's really critical to be able to bring this data together, both at an individual level, but also at a population level, to say, hey, for you, the impact that long-term sleep can have on cognitive performance is different than someone else. So you make sure that you're getting 8 to 9 hours of sleep. Whereas, for someone else, it could be that it's the inflammatory foods that they're going to eat. I mean, it'll be a different balance of things. That's the science that we still have to figure out, by the way. That's the piece that, again, I love all these consumer tracking and wearables and all the biometrics. But I'm like, gosh, you got to bring it together because it's nonsense otherwise.
A lot of it is just totally superfluous. I mean, I'm not
What's the one that you've been like most blown away by?
Well, honestly, my favorite tracker is not even a tracker. It's super low cost. My digital food scale in my kitchen.
Oh, I love that. Look at that.
Yeah, I've been blown away by the utility of a digital food scale. I'm going to be I'm like the biggest champion cheerleader of having a digital food scale in your kitchen and keeping it out all the time so that it reduces the friction to actually using it. $20 on Amazon.
Yeah.
Like Amazon literally makes one. I think it's like an Amazon Basics digital. Everybody should have one. It's the best way to audit what it is that you're eating and to create a little bit of friction when you've got you go to Costco, you buy a big bag of whatever it is, goji berries, dried mango, nuts. Like it's a little bit of just like mental friction when you get to weigh out the exact amount of grams of one serving.
Yeah.
So that you're not like otherwise, because I'm guilty of this too. Like if you put a big Costco-sized bag of whatever I happen to enjoy in front of me, like while I'm doom scrolling Netflix, which I do most nights of the week, like I will easily consume 1,000+ calories of whatever that is, unless there's some degree of friction where in my head I know, okay, this is a serving size. Yeah. Like it would be really gluttonous for me to eat more than. Do I really need more than one serving? Like,
you're bringing back the digital scale. You're going to make that. You're going to make that. I love that because I think one of the things that I'm really concerned about, Max, in all the biometrics tracking that I see people do who are very health aware and they're trying to do the right thing, is that we're losing that connectivity to our body and how we feel about things. Again, I think
totally.
in this world where we love numbers and I am a highly quantitative person, so I love the analytics that comes with this stuff. And I'm like, ultimately, if I don't feel good, I have to be able to be in tune with my body that like today is not the day for the run, right? Or
Yeah.
today is not the day that I'm gonna, go out and eat the 2 servings of whatever. There's something about interacting with the real world that makes this stuff more tangible and more real. And I hope we don't lose that, because I do think that no matter how much you analyze things, there is still something to be said around applying that layer of logic and looking and being in tune with your body around what's the right thing to do.
1,000%. I mean, the whole tracking industry, it's like it's getting out of control. There's
Yeah.
a device that literally it's a sensor that watches your toilet bowl, and it analyzes your stool to try to assess your gut health based on what comes out of your butt.
You're never safe.
Yeah, you're never safe.
Anywhere that you go.
Yeah, no, I have no affiliation, but it's called Throne. I saw it like I was like being, yeah, I was being like marketed it on Instagram, I guess, and so yeah, there's like a device that literally, it's an on-toilet gut health sensor that watches your toilet bowl and connects the dots between your diet and bad bathroom days. So it's like
So
crazy.
you now can also get warnings on your phone
Yeah.
about your bad bathroom days.
What else? What's next?
What's next? I know. What's next? I do think this is where, again, I go back to being human aligned. Like, you have to rein some sanity onto all of this. And I think, again, the great thing about leveraging this technology, being able to leverage what generative AI and the larger category of AI brings is we have long surpassed the cognitive ability of the human being to take all of this data and make sense of it, right? Like, I at one point was like, I had stuff printed out, I was looking, and I'm like, what am I doing? This is ridiculous, and I can't. There's not even there's no good way for me to like correlate between all these different apps, what's going on with my chronic conditions. So the LLMs are great because they can bring it in, they can normalize that data, clean it up, and be able to see the signal in the noise, and be able to augment our decision making. And we still have to make the decision.
Yes.
Like, we have to be the ones that have to balance the bigger picture to say, what does this look like? It kind of goes back to my story with the hard days and the donuts and the cakes. Like, sometimes I got to have a piece of cake. Like, and it brings a smile to my face. Now, should I be doing that, every day I have a hard work day? No. But you got to kind of be able to take agency about the decisions that you have to make that ultimately determine your health.
Makes perfect sense. You alluded to earlier this is just a question that popped into my head as we're talking. Like, you alluded to the environmental cost of AI, right?
Yeah.
But like, I don't know if anybody's quantified this, but what if AI could be used as a tool to get people markedly at the population scale healthier? Like, think about the environmental cost of obesity, of widespread obesity, of the burden on the healthcare system. Like, I think everybody should be using AI if it can improve their health, because my hypothesis would be that it would be a lot better for the environment to have a healthy population as compared to being skittish about your use of AI when it comes to these really important, pressing public health goals.
Yeah. So, I talk about in the last section of the book, I kind of talk about a couple of imperatives that we have to reckon with as we move forward in this world of leveraging AI for health and care. Everything from trust, do we trust the algorithms? Do we trust the institutions that build them? To security and privacy, to how do we build AI for everyone? Because we do want to make sure that, to your point, everyone is getting to leverage this to lead better lives. And we have people in this country, and when I worked globally, that don't have access to some very basic things, but the intelligence can help guide them to the next best thing. So maybe I don't have access to fresh fruits and vegetables, but instead of going for that bag of potato chips, I could get the baked chips, or maybe there is another crunchy treat that has a better nutritional profile with some protein and fiber added in it that I wouldn't have otherwise known about. So again, the technology can lower that cognitive burden and be able to make those solutions visible. Again, the individual then chooses what they want to do, but we got to build it to be able to help be fair and be able to support everyone. And then I talk about the environmental impacts. There've been some really great studies done, Max, and there a couple that have come out around Google's use of data centers. I think those are some of the best ones that I've seen. I think mostly, thankfully, to Google actually releasing some of that, because for you to get that information, the organization has to provide some of that data. The environmental toll can be quite significant in both mining rare minerals, water usage, and a lot of these data centers are in water poor areas. So they're actually taking like municipal water to be able to cool these data centers. It is, and take up a lot of energy and need a lot of water. And so there are a number of different elements like that you kind of get to this point where you're like, can you sacrifice planetary health for human health? I would say no, we should look at how we advance both. And again, forward looking organizations, and I believe both Google and Amazon have come up with pledges, are looking at how do they make sure that they are reducing the carbon emissions and the environmental toll of these data centers. And so, to your point, I absolutely think people need to leverage this technology to look at how they get better health and care. And we should also continue, as we keep tabs on our health, keep tabs on, is this causing some permanent damage especially in places where people and governments aren't set up to deal with this harm. So if we send all of our electronic waste to the global south and there are kids playing with toxic stuff in their backyard, like, are we okay with that?
Yeah,
and,
no.
The answer is no.
Yeah, no way.
But I do think that's and to me, again, it's never this or this. It's how do we optimize this broader picture together?
Yeah. What are some other tactical ways to use AI to improve the health of yourself and your loved ones? Like, I'm assuming you can like ask AI. I'm assuming you can plug in like whatever supermarkets, like even by brand, even by name, into your chatbot, and ask based on whatever your budget is, like to architect you like a 6-7 day meal plan.
Yeah, I really love how you used it to be very tactical, because I think those are exactly the types of things that are helpful. So I would say as an overlay, that mindset of how can I leverage this to reduce my mental load and my mental burden on what I need to do. So if I'm interested in healthy meals, but I'm working, what's a healthy meal that I can make in 15 minutes? If I am interested in healthy meals, but I don't have access to a grocery store and I'm, making do with what the fast food restaurant close to me is, what are the options there that are going to be? And then what are the portions? Kind of back to your point about like visually seeing stuff. There are some very calorie dense foods and you don't necessarily need the entire meal. So how can you balance that? So I think those are kind of from a tactical perspective. If you take the categories of nutrition, sleep, and activity, you can kind of start off with a structure of what are some tactical things that I can do to help improve things. And then you can layer on there other things like air quality where you live, and do you need to complement some type of filtration in the home, or stress level that you carry, and what do you do to be able to deal with that, and so on and so forth. So there are ways to look at that. But I think that very practical approach to how can what's just an easier way for me to do this. is a really great way to go. I heard someone use it. They're like, I just cannot get up in the morning early enough to cook myself a healthy breakfast. And so they leverage an LLM to say, hey, what can I put together in 5 minutes that gives me the protein and the fiber that I need? And so it came up with 3 really great shakes, and everything is ready. She just dumps it in, she blends it, pours it into her thermos, and as she's driving into work, she drinks it.
That's amazing.
And now she doesn't have to go through a fast food place to pick up something that's
so great. Yeah, I use it for recipes all the time. It's like, I think it's like such a wonderful tool. Like, I'm so grateful that we have it.
I'm still waiting for it though to tell me, because I do that too, and I'll take my phone, I'll stand by the fridge, and I'll be scanning stuff, and I'm still waiting, Max, for it to just be like, there's nothing good you can make.
Yeah.
Like, you're not going to be able to mix cilantro and green onions and have like a,
Sorry, Nasim, you're out of luck.
Yeah, try again.
That's so funny. One cool way to use it is you can literally snap photos of, there's so many cool ways to use it. It's like absolutely incredible. But you can snap photo if you're dining out, you can snap a photo of your meal, or even at home, snap a photo of your meal. And you can ask it to estimate the macros on that meal. It's not accurate. I've tested it, but it's like directionally, it's like in the ballpark.
Well, and I think between not knowing and having something that's directionally in the right ballpark, it's better, and it's going to continue to get better, right? I think that's the thing that's really fascinating about this technology, is how quickly it is improving and getting better. But it does enable you to kind of have that data that you didn't have before.
And it tracks it over time because it's got memory. Like, I've been using it. I've been on a cut, and so I've been like taking like half naked selfies and asking it to estimate my body fat percentage.
Is it good?
Yeah, it's directionally it's great, and then it's pretty accurate. Like, it's not perfect. It doesn't take the place of like a skilled DEXA scan operator, but like DEXA's I've never done a DEXA. It's cost prohibitive. It's a pain in the ass. You get exposed to low dose radiation.
So I'm totally going to send you something. I met a phenomenal entrepreneur that's doing DEXAs, super affordable, super reasonable. And I think doing it to get a sense of both your bone health and body density is really great. Affordable price point. They I think, are the largest or second largest providers of scans across the U.S. So I'm going to send you that link. But
that'd be amazing.
Again, it also kind of will give you, then you can calibrate between the two, and get a sense of like what's the delta between the picture and actually doing one.
What about?
I wouldn't do one every month, but
no. What about these like AI assisted diagnostic tools now that are popping up, like the Clearly Scan? Have you looked into that at all?
Yeah. So it's I will say there's a lot of really exciting ways to be able to diagnose and look at things. There are some of these diagnostic tools, Max, that have been around for a really long time. So, AI was looking into eyes and retinas and diagnosing a host of diabetes and heart disease for a number of years, right? We didn't get to hear about it as much, and it wasn't as large scale, but there are technologies that have been around for a while that have been doing that, in terms of kind of being able to look at a certain number of things and diagnose things. I think when it comes to pulling information together, again, I kind of go back to our earlier conversation around what's the evidence around this. So we're trying to do a lot of diagnosis, what could be going on, and you get everything from like you're perfectly fine to you've got 6 months to live. So what's the evidence-based likely scenarios, and also understanding that at this time the LLMs aren't a substitute for actually getting diagnosed for something. Having said that, the ones that are specifically focusing on particular conditions, I've seen some data where they can be just as good, if not better, than the clinician. So,
and the technology is advancing so rapidly.
So rapidly. Yeah.
It's crazy.
Lots of
You think
lots
one
of
day
potential.
AI is going to replace doctors?
I get that question asked a lot, and I think my feeling on that is AI is going to replace the doctors of today and the way that medicine is practiced, but it's not going to replace the profession of healing and caring for other people. So, and I hope it does, because I hope that we're still not thinking and functioning the same way as we move forward as we are today. I hope that we are leveraging technology to augment our capabilities to be able to more holistically provide care for people. I talk in Intelligent Health about how today's healthcare is really focused on what happens when you visit the doctor. And then there's like almost nothing that happens until the next time that you visit the doctor. And if you're an otherwise healthy person, you're seeing your doctor maybe, I don't know, once a year, maybe twice a year. I think the healthcare of the future is going to be all that stuff that happens in between the visits. So your doctor is going to constantly be receiving data from you. They're constantly going to be processing that. There's AI is going to highlight upcoming risk. Not that you have this chronic condition, but here's where these numbers are going. We bring people into clinics annually and we watch their hemoglobin A1C, which is a measure of their blood sugar, creep up year after year and don't do anything about it until they have diabetes. We see their blood pressure is creeping up year after year and we don't do anything about it until they've got high blood pressure. That in-between time, I think, is what the focus is going to be, because we're now going to have the data and the ability to separate signal from noise to say, hey, here are 5 things that you can do where you're not going to get diabetes. If you do these things, you're not going to get diabetes for 5 more years, for 10 more years. You will never get diabetes if you do these things. Or here are the things that you can do to be able to prevent high blood pressure. Or you're genetically predisposed to this. You're going to get it. Here's how we're going to mitigate all the risks around it and make sure that you go through this in the healthiest way possible. So I think what it means to be a physician, a nurse, someone working in healthcare, like we're still going to need people to connect, to help support on difficult decision making, to be able to go through those nuances that a person needs. But we're not going to need a doctor to titrate medication. Like we should not be doing that. We're not going to need a doctor for some of the stuff that we go to the doctor for today. There are going to be better ways of being able to handle that.
To practice medicine, yeah. Super exciting stuff. Well, I'm certainly optimistic, and I can't wait to see what the future holds. It's such exciting times.
It really is. And I think, again, to your point about how rapidly all of this is improving, I think there are potentials for things that are going to happen when it comes to drug discovery, to diagnosis, to actually understanding what goes into health and longevity that are going to get unlocked out of us being able to bring all of this data together and apply that intelligence to it. So I am super excited.
Yeah, and the rising tide lifts all boats.
Yeah.
You know, we might have different boats,
yeah.
right? Like some people are out there in yachts, and others with like little dinghies and Boston whalers and whatever. But the rising tide, like all of those boats, eventually,
it has the opportunity to bring all of us up.
Yeah.
You'll be there with a digital scale on your boat.
I'll be there with my digital scale on my boat. Well, thank you so much for coming in. Intelligent Health, super exciting read. I'm gonna get a copy for my brother, who's a software engineer. I'm gonna be like,
amazing.
Look, there's $1 billion opportunity.
It is right there.
So cool. I've got one last question for you, but before we get to that, where can people connect with you on social media, and where can they pick up your book?
Yeah, so Intelligent Health comes out on March 17th. It's available anywhere you purchase books. It's currently available for pre-order on Amazon, Barnes & Noble, and I am excited to connect with people on LinkedIn. I post regularly around topics from intelligent health, not only how we can continue to empower ourselves as consumers of health and care, but how that entire ecosystem needs to evolve with us as we're going on this journey.
That's a great platform to be posting that on LinkedIn as well. Well, thanks for coming out. The last question that gets asked everybody on the show, what does living a genius life mean to you?
Oh, Max, I think for me, living a genius life means that we leverage all the data that we have to ultimately be able to live our best and healthiest life.
Hell yeah. Love it. Thanks for coming out.
Thank you, Max.
You're the best. Thank you guys for listening. Share this episode with friends and loved ones that may benefit from it, and I will catch you on the next episode. Peace. Hey, if you liked that video, you need to check out this one here, and I'll see you there.